Okay, for this first excuse me, video, I'm going to be demonstrating how to insert a Foley catheter, and we're just gonna pretend it's a female. And then I'm also gonna be demonstrating stoma care and placing an ostomy bag. So first I'm gonna do placing a Foley. So before I even start, I'm going to check for a physician's order to place the Foley. And then once that's all done, I'm going to check with the patient. I'm going to do medication rights. I'm going to do right medication, right dose, right patient, right time. I think I said right route, right documentation. You know what I mean. And then I'm also going to educate my patient as to why we are placing a Foley, like mentioned in the video, like for retention, or if we need accurate measurements of urine output. I'm also gonna check that I have the right patient by having them state their date or their name and date of birth, and I'm gonna check on their ID bracelets with everything we do. So getting started with inserting Foley, I'm gonna wash my hands, and I don't have gloves, but I'm gonna pretend I have gloves, of course. And before I set down my Foley kit, the table is going to be waist high, so I'm using my kitchen countertop because it's about waist high. And I'm going to clean the area with the purple wipes that they have at the hospitals. I know they usually use those, and wait for it to dry. So then I'm going to set my kit down. I have clean gloves on. I've already cleaned it. I changed my gloves after I cleaned the table. Here's my patient. I'm going to move him over here. So now I'm going to open the Foley kit, and I'm going to open the top first, only touching the outside of the kit where it's non-sterile. So only touching the outside. We're going to open our Foley kit. I'm going to try not to break sterile field. I know I'm not supposed to reach over. So I have this open. So I'm going to grab the sterile gloves, and I like to lay them on the sterile part, the inside, because it's just easier to put them on right here. I'm going to take this blue pad and lay this under the patient. And I'm going to take the cover. I wish I had more room. I'm going to move this so you can kind of see. Here's my patient. Okay. So since it is a female, we're going to use this. I don't know if you can see that. Okay. And then I'm also going to take this off. And set it over here. Okay. So now I'm going to take off my dirty gloves, and I'm going to apply the sterile gloves. So open them up, and then we're only going to touch this inside part. Okay, now my sterile gloves on. Move that. So I'm now going to open the cleaning things. I'm also going to make sure the patient doesn't have an allergy to iodine before I insert or clean them with the iodine. And then I'm going to put the lube over here. done all of this before I applied my sterile gloves. I just realized, like, I probably should have done this before I applied my sterile gloves. But I did it before, but I realized I made a mistake. So I would have opened that and opened the lube before I applied my sterile gloves. Okay, and then we're gonna keep our dominant hand the clean one, and then our non-dominant hand is gonna be the dirty one. So in order for me to do this, I'm going to turn my patient, I'm trying to make it to where you can still see. And I just dropped all of that. Okay. Sorry, this is really hard to do at home. Okay. Let's pretend I'm keeping sterile filled. Okay, so now I'm going to clean the patient. I'm going to take one at a time. So, dirty, non-dominant hand, clean, dominant hand. And we're cleaning a female. We're going to open up the labia, swipe from top to down. Wait, no, we're going to go down, up. Yeah, down, up. Wait. Why am I making this so hard? We're going top down. I don't know why I can't think. Top down, one side, discard. And then top down the other side, discard. Come on. And then top down in the middle, discard. So then we're gonna grab, this, the Foley. I'm gonna put it over here. And trying to keep it where you can see it. And we're gonna hold it, take this off, take the non-clean stuff off, and then put a generous amount in the lube. And then we're gonna tell our patient, take a deep breath. I'm gonna grab this. I'm gonna actually go ahead and put the saline that we insert to inflate the balloon. I'm gonna go ahead and attach it just so once it's in, I don't have to find the syringe and then possibly having it fall back out and having to find it again. So I've already got it attached, and I'm gonna have it way up here, and with my dirty hand, I'm gonna kind of hold it up. My dirty hand, I'm gonna open up the labia, and then I'm going to insert the catheter, keeping it off dirty table. This is very hard to hold on to. So I'm just gonna feed the catheter in. And by now, I should have gotten some urine output. So when I have urine output, I know that I'm far enough in. So I'm gonna use about 10 cc's of saline to inflate the balloon. And I'm gonna document that I used 10 cc's of saline to inflate the balloon. I'm gonna take this out, take this off. And I'm gonna pull it, and it can't come out. Then I'm gonna take off my gloves, wash my hands, see how my patient's doing, give them their call light. I'm gonna document that I inserted it, the time that I documented it, or the time I inserted it, And I'm going to document how many cc's I used to inflate the balloon in the Foley. Okay. So now I'm going to take all this out. Alright, now I'm going to show how to do stoma care. So in my kit, I did not get a measuring tool for a stoma, but I'm just going to pretend that I have one and state how to do it. So first, I'm going to check my patient. If they don't have an ostomy, then I have the wrong patient. So I'm going to make sure it's the date to change the ostomy bag. I'm going to take off the old one. I'm going to document the output, the contents of the ostomy. I'm also going to assess the ostomy, make sure it's pink, there's no skin breakdown, and I'm going to document everything that I see after I'm done, obviously. So first, I'm going to take the measuring tool, and I'm going to measure our stoma. So in the video, she said about 5. So we're just going to pretend 5 again. So I'm just going to take that off, and I'm going to trace this. So as good as it's going to get. Okay. So then, so if I had the measuring tool, I would have cut the circle out. I would have made sure it went all the way through, like it fit over. And then I would have cut the circle out some more if needed to fit all the way out. And then I would have traced the circle on the ostomy bag. And then now, which I pretended like I did here, and now I'm going to cut it out. And I wish I had some smaller scissors, but... hopefully that fits. So I'm just gonna make sure it fits okay, it fits. So before I put the ostomy bag down, we're gonna put the cream, like the adhesive down. Here's my cream. And then we're gonna set it over the stoma. And we're gonna make sure that the ostomy bag is closed. And we're gonna get most of the air out, of course, too. But we're gonna make sure the ostomy bag is closed. And we're gonna educate the patient, like why we're changing it and what we're looking for. Tell them like if we see anything wrong with their stoma, like based on just if there's skin breakdown or anything. And then I'm going to document. And I didn't state, but before I would have done all this, of course I would wash my hands and use clean gloves. And I would document whenever I'm done the date that I changed, the time. I would have documented what I found in the ostomy bag, like the contents, and I also would have documented the stoma and what I found. So next video will be at enemas. Thanks.